Sawadee Krap. Good morning. My name is Björn Bodenstein and I'm the Managing Director of Siemens Healthineers based here in Thailand. Let me tell you a little bit about Siemens Healthineers and what we do. We are a medical technology company based in Germany, and our purpose is to pioneer breakthroughs in healthcare for everyone and everywhere. And in this scope, we are trying to target the most prevalent diseases and conditions globally, which are cancer, cardiovascular and neurovascular diseases. And within this, digitalization plays a key role. And why is that? We have, as a company, over 600,000 devices installed globally. Instruments, softwares and medical equipment in the laboratory, diagnostic imaging, advanced therapies and radiotherapy. And with all these devices, we create around 240,000 patient touch points every hour. So you see there's a lot of data collected and data stored. And now with this amount of access to data, we have a huge responsibility to use this purposefully to create access to healthcare and to create better outcomes for patients. So how do we do that? We use these massive data sets to create smart algorithms that help physicians to read medical images more precisely, to unveil the unseen. For example, we had introduced during COVID an algorithm on computer tomography lung scans that detects automatically lesions caused by COVID in the lungs. And we have also made this available in Thailand already. So the physician gets a better diagnosis on the patient, and as a patient you get a better outcome for yourself. And if you take this technology further using more artificial intelligence, you can create digital twins of organs of a patient, for example of the heart. And with this digital twin, you will be able to predict treatments before you start the treatments, because you can simulate how, for example, the heart would react. We have published also white papers and literacy about that already. Another aspect, when I talk about creating access to healthcare, digitalization is an enabler for this. We have a solution called Syngo Virtual Cockpit, where you can from one location connect into another location and support physicians and technicians to operate medical equipment. Because you know, being here based in Bangkok, you have a lot of access to care and a lot of hospital providers at site and available. If you move to upcountry, that might not be the case, and the physicians and the technicians might be not as well trained as they are here in Bangkok. So this technology that we also have implemented in Thailand helps clinical sites with skilled people to support sites that don't have the same infrastructure and the same manpower. So eventually, all we do here, again, is to create access to healthcare and support physicians to give the best and more precise treatment for patients. I believe, looking at all the attendees at HMA this year, I have the feeling that it's long overdue, right? HMA brings together all the players now after 2 years of pandemic, of the public healthcare sector, of the private sector and out of the industry. And this platform is great for everybody to share what they have learned over the last 2 years of pandemic with each other. And there you create the value, there HMA creates the value, because the key part and the key outcome that we have to create is bring this learning to one another. So the pandemic had shown that not everybody was as well prepared for this pandemic, and everybody had learned a lot. So you put the pieces together, like we did that with a team of very experienced consultants that are based all over the world. They collected from a lot of collaboration partners globally how the pandemic had impacted them. And with this, we created a companion, a collection of white papers in different aspects on how to learn from them, especially in digitalization. And that's a great platform to share this and to be ready if the next unforeseen events might come to us. Excitement, connection, learning, digitalization, and collaboration.